Hi everyone, my name is Jen Lalazerne and I'm a clinic director here at Step by Step Academy working with children with autism. I am the clinic director of the adolescent building and I'm also here with my coworker Amanda.
Hi, I'm Amanda Yeager and I'm a board certified behavior analyst. I also work here at Step by Step Academy in the Adolescent Center. I write behavior plans and treatment plans and oversee the implementation of those plans.
All right, we're here today to talk about severe problem behavior, and we'd like to talk about the three main objectives in our presentation today, and you can see those on the slide on your PowerPoint. The first is to understand what severe problem behavior looks like, particularly in a clinical setting, but in other settings as well, and what treatments have shown some efficacy in reducing those problem behaviors for all different types of challenging behaviors. Our second objective is to talk about how to write a clear and concise behavior plan that addresses your target behavior or behaviors and also serves as a guideline for your staff who may be implementing those behavior plans to ensure the best consistency in approaching those problem behaviors. The third is to identify examples of severe problem behavior and some of the treatments that can be effective in those in all different environments, both in recent research as well as in our clinical setting here at Step by Step Academy. So what exactly is meant by severe problem behavior? For the most part, these are behaviors that are highly socially unacceptable, are dangerous to the individual or his family, other people around and in the community. They can include criminal behavior or behavior that causes an extreme amount of distress to the individual, other loved ones, and the family as well. There are many examples of severe problem behavior, and we have some listed here. Could be aggression towards others. One that's not listed here is severe property destruction. There are several eating behaviors that can cause medical problems, and two that we'll talk about are rumination and pica. Also encopresis and hair pulling or removal. Another one is self-injurious behavior. We have a picture here of the hands of one of our consumers who bites his hands frequently and has permanent tissue damage to his hands as a result of that self-injury. I'd like to talk a little bit about the prevalence of severe problem behavior in people with autism and/or with intellectual disabilities. There's a recent study from 2011 that shows that 68% of children and adolescents with autism showed aggression towards a caregiver, and 49% showed aggression towards a non-caregiver. Another study showed that almost 33% of children in the study sample with pervasive developmental disorders had some sort of self-injurious behavior. Jumping down to the study from 2005, Stiegler reported that a small but significant portion of individuals with developmental disabilities have demonstrated having pica. And then I'd like to talk with some detail about a recent study from 2011 about self-injury in our population, especially that's severe enough to cause permanent damage, tissue damage to those subjects. What they found in their study is that there's a high level of chronicity to the self-injurious behavior, meaning it's chronic, sustained over a course of years. When they did this study, they looked at a set of subjects who had been studied 18 years prior, and the number of individuals that they looked at was 49. What they found with these they were adults at the time of the study, is that they had chronic behaviors such as skin picking, self-biting, banging their heads with their hands, banging their heads into objects, and those were such the case in the first study 18 years prior as well as the 18 years later. And what they found, unfortunately, is that there was not an overall change across those 18 years in topography or frequency or severity of those behaviors. What they did find is that several of the people when they were younger were wearing protective devices or protective gear to protect themselves, and there were less people wearing that protective gear 18 years later, but the authors theorized that that could be due more to cultural issues and wanting to reduce that in this population rather than an actual indication of a reduction in severity of the self-injury.